Welcome, everybody. Today we have continued to have a very high level of COVID-19 across the entire United States, including in Colorado, which has a lower rate than the average rate in the United States, but still very high prevalence. Be very careful. 2,189 new cases. Hospitalizations remain elevated at a very high level, 902 hospitalizations. That's 8 more than yesterday. Of the 902, 17 are pediatric hospitalizations, 17 kids, the rest adults. And we have a total of 7,560 deaths in Colorado. My heart goes out to each and every survivor, the families who left loved ones behind. It remains at a very high incidence level. And of course, if you're not vaccinated, please get vaccinated. We'll talk about why that's important today and what that means. But even if you are in crowds around others, it's smart to wear a mask. It's smart to be careful. It's smart to limit large activities with a lot of others, especially indoors during this time. Today we're going to talk a bit about President Biden's announcement. I guess we're still waiting for details on a lot of that and guidance on a lot of that, so we don't have a lot more to provide about the specifics. We're awaiting that. We're also joined by our state epidemiologist, Dr. Rachel Herlihy, who will update you on where COVID is in Colorado, as well as our incident commander for COVID-19, Scott Bookman, who will update you on hospitalizations in Colorado as well. So with that, let me just show you a few visualizations that that really bring home why vaccinations are so important. Not that one. We'll get to it in just a moment. Do we have the, not that one. Should be slides 1 and 2, or 2 and 3. We're waiting on those. One of them is a new visualization that really shows the impact of vaccinations in our state. And we're trying to load that. Could we get some help over there? Not that one. We're having some technical difficulty there. Yeah, it's the next slide, right after that one. I saw it on the small screen. Next slide. There we go. This shows you why you should be vaccinated. It's not because President Biden thinks you should be vaccinated, or President Trump thinks you should be vaccinated, or Governor Polis thinks you should be vaccinated. It's because you care about your own health and you want to protect yourself, and that's really why you should make the decision to get vaccinated. There's 894 people vaccinated in our state. Of those, 726 are not vaccinated, 168 vaccinated. So just to put this in perspective, that 168 who are vaccinated, that comes out of the 75% of the population. So most of the population is vaccinated, right? So this big part of the population, only 168 are in the hospital. Out of that 25% that haven't been vaccinated, almost everybody who's hospitalized, 726 hospitalizations. We would not be anything close to hospital capacity or crisis or ICU limits if everybody was vaccinated. We'd have 200 people in the hospital instead of 900 people in the hospital, well within the norms. As Scott Bookman will update you on the hospitals, we actually have the lowest ICU available rate that we've had since the start of this crisis, in part due to the unvaccinated with COVID and just other types of trauma that goes up seasonally this time of year. Some hospitals are reaching very close to their capacity limits, and that wouldn't be happening if people were vaccinated. In addition to this big group, the red, coming from that small sliver, 25% of the population who's not vaccinated, the people who are vaccinated, a minority of the hospitalizations, have better outcomes. They're in the hospital shorter, and they're more likely to get out. And that's important when you look at this. It's important to know that this is where all the data shows. And there's people out there considering taking it. I also want to make this very clear. We do several thousand people get vaccinated every day in our state, 3, 4, 5, 6,000 a day. During the height, it was tens of thousands, but 3, 4, 5, 6,000 people get vaccinated a day. There are 0 people in the hospital from side effects of the vaccination right now in our state. So I want to be clear. There's 894 people hospitalized with COVID. 726 are unvaccinated. Nobody's hospitalized from the vaccine. And 168 people who are vaccinated. are hospitalized, and they are mostly older and with pre-existing conditions. But it shows that even though the virus is much less severe when you're vaccinated, it is still to be taken seriously. But we would not have any issue with hospitalizations, and it would significantly reduce the spread if everybody was vaccinated. Next slide, please. So, be smart. Look at the data. Look at what experts are saying, what doctors are saying, what elected officials of both parties are saying, what hospitals are saying, and be smart about it. It's simple data. You have 25% of the population that is 80% of the hospitalizations. And they have worse outcomes, higher death rate, longer hospital stays, simply because in some cases they perhaps haven't gotten around to it yet, or in other cases think they might have found something that the world's top scientists and doctors missed, which in fact is misinformation. Because we are presenting the accurate, objective information to you. Those were hard numbers of hospitalizations. 160 unvaccinated, 720 of the people hospitalized, 720 people hospitalized unvaccinated, 160 vaccinated, and that's cold, hard facts. We're just telling you how it is. Those are the facts. And while, of course, the top medical experts in the world, and President Biden and President Trump and Governor Polis and everybody cares about your health, you care about your health more than anybody. And that's why I'm strongly encouraging you, if you haven't yet, get vaccinated. And when you're eligible for the third booster shot, that's showing tremendous results as well, and I encourage you to do that. With that, I'll turn it over to Dr. Herlihy to cover where we are with COVID cases in Colorado.
Good morning. Thank you, Governor. So I want to begin here, where we typically do, looking at our case rates here in Colorado, but also compare those case rates to the U.S. rates that we're seeing overall. So this figure shows you Colorado case rates in green. We're looking here at our 7-day moving average compared to the U.S. shown in blue. So what you might notice on the far right end of this figure is that we have seen a recent decline in cases. That's really been just the last couple of days. But I do want to urge some caution in interpreting this data. One of the things that we often see following holiday weekends are some data aberrations, and that can be due to different people seeking different types of testing on a different time frame. So for example, on holiday weekends, individuals might delay seeking testing by a few days. We also potentially can see some delays in reporting. So again, while this is certainly encouraging news to see that these case counts are going down in the last couple of days, I want to urge caution in not over-interpreting what we're seeing right now in our data. But overall, we do continue to see that Colorado's case rates are below the national rate, and that is certainly good news. When I get to the hospital data, I will show you that this trend is not the same for our hospitalization data. We are continuing to see an increase there. Next slide, please. So that decrease that we've seen in the last couple of days does show up here in this figure, which is showing you trends by age group. Overall, we continue to see the highest rates of disease occurring in our school-age children. So that's going to be children 6 to 11 years, shown here in a teal color, and then children 12 to 17, shown in orange. You'll see that our 18 plus or adult population is the next highest level, and then lowest is our 0 to 5-year-old population. Again, that decline we're seeing certainly is good news to see, but we're not yet sure if that is a true trend or if that's some sort of data aberration at this point. Next slide, please. Compared to the rest of the country, as I mentioned with 2 slides back, Colorado does continue to have lower rates than most other states. You can see here that we are 12th from the bottom here, so 12th lowest rates in the country right now. So certainly good news to us, and I think that does have to do with the higher vaccination rates that we have here in Colorado. But again, we know that that doesn't mean we are immune from seeing rapid increases in cases or increases in hospitalizations and deaths here in the state. Next slide, please. Those trends are regional, where we're seeing the highest rates in the country right now. So this is a map of the U.S. that shows you that the rates in the country are highest right now in the southeast part of the country. We are also seeing some higher rates of disease transmission in some of our neighbors to the north, some states to the north, especially Wyoming and states north of that. So we are seeing some regional differences across the U.S. right now. Next slide, please. This is similar to the case data that I showed you, but comparing Colorado's hospitalization rates to US hospitalization rates. As I mentioned, we are not seeing the same sort of decreasing or even flattening trend in hospitalizations here in Colorado. We are seeing a continued steady increase in hospitalizations in the state. We do, again, compared to the US, have a lower overall hospitalization rate, so that's certainly the good news. But again, we're not immune to potentially seeing potential rapid increases in hospitalizations. I do also want to highlight the fact in the box here, as the governor mentioned, that Colorado's hospitals are reporting that 81% of currently hospitalized patients are unvaccinated. Again, the burden of transmission, of hospitalization and death in the state continues to be among the unvaccinated population. Next slide, please. This slide shows similar data, but comparing deaths in Colorado to the rest of the US. When I presented this data a couple of weeks ago, we were actually not yet seeing an increase in deaths here in Colorado. Unfortunately, in the last couple of weeks, we have started to see a clear increasing trend in the number of deaths that are occurring. Similar to our hospitalization data, and even a stronger trend here, we see that 85% of Colorado's recent deaths were among unvaccinated individuals. The good news here, of course, is that our overall mortality rate continues to be lower than the US mortality rate overall, but it's certainly a tragedy that we're continuing to see these deaths increase, especially among our unvaccinated population. Next slide. And finally, earlier this week, we did launch a vaccine breakthrough dashboard on our website, so I encourage you to check that out. That website allows individuals to look at our data, the same data that we are using and interpreting, to really try and understand the risk of becoming a case, becoming hospitalized, or dying due to COVID-19 for individuals that are vaccinated versus unvaccinated. So vaccinated individuals are 3.4 times less likely to become a case, 3.7 times less likely to be hospitalized, and 5.8 times less likely to die from COVID-19. Next slide, please. And with that, I'll turn it over to Director Bookman.
Thank you, Dr. Herlihy, and thank you to everybody for coming today. Before I start, I want to take a moment to recognize all of our healthcare workers who are on the front lines and who for the last year and a half have been tirelessly caring for all Coloradans with COVID and without COVID. And the stress and overwhelm they have felt, the burden of this pandemic has been remarkable. We hear story after story of our nurses, our respiratory therapists, our physicians who are working around the clock to take care of Coloradans with COVID. And what we see here on this slide is that as of today, we're at 902 COVID hospitalizations in our state. That represents the second highest amount of COVID hospitalizations at any point in this pandemic. It has now eclipsed the first wave that we saw in the spring of 2020. On the next slide, what we'll show here is the decrease in total ICU beds available in our state and the trajectory that we are currently on. The difference between this wave and all future or all past waves is that Coloradans have returned to their normal lives. Those who have been vaccinated have been given the opportunity to go out and live their lives. What comes with that is additional cases of trauma, additional heart attacks, additional strokes. We have seen people who have delayed receiving care over the course of their pandemic because they were afraid to go to their doctor. And this is all coming together with the increase in COVID hospitalizations at this point to really stress our healthcare system. As of yesterday, we dipped below 200 ICU beds available in our state. That we were at 197 beds available. Our hospitals are beginning to put into place their surge plans. Many are opening up additional ICU beds. They're canceling scheduled surgeries. They're even closing some of their clinics in their outlying facilities so that they can bring staff in to their hospitals to increase staffing levels there. I cannot stress enough the state that our hospitals are currently in today. The stress that they are feeling, the impact that this wave is having on them, and the absolute importance of getting vaccinated to end this pandemic. As the governor and Dr. Herlihy have indicated, the burden of the unvaccinated on our hospitals is profound, and it impacts all Coloradans because those who are vaccinated will struggle to get the same level of care in the hospital that they would get if there were fewer COVID hospitalizations. And thank you. I'll turn it back to the governor.
Thank you. Thank you, Scott. And I want to add my voice to his in thanking our nurses, our hospital administrators, our hospital workers. The numbers show us that it's the unvaccinated who continue to suffer the most, be hospitalized the most, die the most, also inflicting greater spread in our communities. I was so excited back in December of 2020 when I signed the FedEx slip for the very first shipments of the life-saving vaccine. You could really feel the sense of hope in the air. But it's disappointing that about a quarter of our fellow Coloradans have not taken advantage of this opportunity to protect themselves and their families. We're seeing needless hospitalizations. We're seeing needless deaths. The vaccine is completely free and widely available. And people shouldn't have to wait till their employer or their president or others tell them to get it. You should seek it out and get it, because the life that you save could be a loved one, could be your own. We hit a milestone today. We are now at 75% of all eligible Coloradans got at least one dose of the vaccine. 2 weeks ago, we announced that 75% of adults 18 and up have gotten it. Now we are at 75% of everybody 12 and up has been vaccinated in our state. We are at 56.8% of 12 to 17-year-olds, and 76%, just over 76% of those 18 and up have gotten their first dose. It's an important accomplishment, but it also means that there's 25%, 1 in 4 Coloradans who are eligible, who still need to go out and get protected so that we can end this pandemic. I'm sure yesterday many of you saw President Biden's announcement around the next steps of his administration to have a plan to tackle the virus and the pandemic, fight COVID-19. There's a number of elements to that, but the federal efforts combined with many local and state efforts will lead to better testing and many other successful ways to contain the virus. The president's actions are in some ways similar to what Colorado did a few weeks before, in that we required our state workers that are around others in our youth facilities, our prisons, to be vaccinated, and other state workers to either be vaccinated or be tested regularly. That's in the process of being implemented, just as it is for federal employees, federal contractors, and many others. But again, as an employer, I care very deeply about all 31,000 of our state employees. And of course, I want to protect them and keep them safe. But I think that each and every one of them cares even more about themselves and their families. Our presidents care for the welfare of our family. Governor cares for the welfare of your family. But I know that you care the most for the welfare of your own family. We're making testing widely available across school districts in our state, available for students on a regular basis, surveillance testing, also for those who might have been exposed. We really find ourselves at a unique point in this pandemic. We know how to end it, but we need the will to do it. And the majority of Coloradans are protected from the worst outcomes of the virus. If your whole household is vaccinated, you can live your life in many ways like you did before the pandemic. You might contract COVID because of the high levels of community spread, but you have a very high level of protection. But if members of your family aren't vaccinated, it could very well be deadly for them, and life can't go on as normal. And I know that people are frustrated and scared because 1 in 4 Coloradans are unvaccinated, and as a result, we continue to see community spread. But there's simple steps that we can take while we work to vaccinate more Coloradans to minimize the risk of those who are your unvaccinated children, for instance, 11 and under, getting COVID. Until children are eligible to be vaccinated, which we hope will occur in October, they are dependent on adults doing the right thing, which means adults getting vaccinated, wearing masks in indoor public spaces. Because even though 75% of all eligible Coloradans have gotten at least one dose of the vaccine, that's only 58% of Coloradans that are fully vaccinated, because everybody 11 and under is not yet eligible. So the nearly 25% of Coloradans who haven't gotten the vaccine are more than 4 times as likely to wind up in the hospital. And we see that in the numbers. The unvaccinated are filling our hospital beds. We would not have any type of crisis in the hospitals with regard to capacity if everybody was vaccinated. We would probably be in the 1 to 200 hospitalized range instead of the 900 hospitalized range. But that's our hospitals. This is a very personal thing at a personal level. And I mean, I'm sure in some abstract way you care about our hospitals, but you mostly care about yourself and your family. Please get protected. Please get protected. We can do this. We can end the pandemic. But we're not going to end it by pretending that it's already over, when about 900 of our fellow Coloradans are still currently in the hospital, and unvaccinated Coloradans are dying every day from the virus. For more information on how to get vaccinated, please visit covid19.colorado.gov/vaccine, your local pharmacy, your doctor's office, your hospital. It's free, it's quick, it's easy, and it is the best, most informed decision that you can make to protect yourselves. With that, I'm happy to take some questions.
Governor, we had a discussion in our news editorial meeting this morning about enforcement of Biden's directive in terms of, those companies and the state enforcing whether or not their employees are vaccinated. How do you plan to do that? Have you discussed that yet?
Yeah, well, as you know, the state a couple weeks ago moved to requirements for a number of our folks that have a custodial relationship with people. So when we have youth facilities, our veterans facility, Fitzsimmons, people who have no choice but to be in and around our state workers, we of course have the responsibility to protect their safety. For other state workers, they can either be vaccinated or test regularly. So we as an employer are implementing that for ourselves, just as employers of all sizes are. In the last week alone, employers including Aero Electronics here in Colorado, Northwestern Mutual, United Airlines, Chevron, and SoulCycle. Just to show the broad spread of companies. I mean, companies like SoulCycle and Chevron are rarely mentioned in the same sentence, but they've both taken steps to protect their employees and make sure that they're vaccinated. What I'm here to tell the people of Colorado is you shouldn't wait until your employer or your president or your governor says get vaccinated. You should get vaccinated because it will protect you and your family. However much your employer loves you, however much your governor loves you, you love yourself, your family, and your kids even more than I do, even more than your employer does, even more than President Biden does. So please, take the step to get protected for yourself and your family today.
I'm glad Russell went first on that because I can take another swing. I didn't hear how the state will enforce. Yesterday, the Colorado Department of Labor and Employment said there's no enforcement authority to CDLE.
Yeah. Okay, maybe I missed it. The federal is not enforced by the state, to be clear. So if you're talking about President Biden's announcement, we do not enforce that. We have developed the implementation for our state workers to enforce it, just as many employers have. We're a large employer. We have 31,000, but Aero has 3,000, United has 2,000. All of these in our state. They have more other places. Every employer is working on the way that they do that. So we would be happy to provide how we're doing that for our own workers, the ones that are around others, and therefore we're taking the additional steps for the requirement, the testing protocols. We have all that. But the federal piece is not, that's not something the state is involved with enforcement of. We are expecting rules from the U.S. Department of Labor. And we don't know more than you know at this point. We've read, just like you have, that there could be fines for companies or fines for however they choose to implement that under their authority. But that would be done through the U.S. Department of Labor. That's not something that we are actively investigating or looking into because it is the U.S. Department of Labor.
At some point, it sounds like the state might have more information in terms of enforcing private businesses the state making sure private businesses are enforcing this.
Look, we don't have more information at this point. We have the same information that you have, which is the broad outlines of what it would look like, and they've notified us that the U.S. Department of Labor will engage in rulemaking. So we have not seen that, and we'll probably see it the same time you do. If we get some idea about it, we're happy to share it with you. But all we really know at this point is what's been put out there.
Wondering about the ETA on when you'll have more information on the Biden plan. Is that something that you anticipate having more about after Monday when you visit? And also, what is the state doing to meet demand of that plan when it comes to testing and vaccination?
Well, there's several aspects to the plan. We appreciate the increase in testing capacity that was announced. We have not been given the exact timeline yet of when we will receive those tests. We have sufficient tests today. In fact, they're available for every school student, but certainly, particularly some of the instant tests, which were mentioned in the president's remarks, we are trying to pin them down on exactly when and how many we can expect. We will await those eagerly. They also, as we indicated, will move forward with rulemaking at the U.S. Department of Labor. And then we have a number of federal employees in Colorado, and they will be, of course, subject to federal employment policies, just as any private employee is subject to their company's policies, just as our state employees are subject to the state employment policies. And we have a number in Lakewood, of course, at the Federal Center, but also many other parts of our state, including members of the U.S. military, which also fall under separately a Department of Defense vaccination requirement. Yes?
Hello, Governor. I'm Jesus Carrasquel from
Sí.
Noticias Univision, Colorado. Can you hear me, Governor?
Sí.
Ok, Gobernador, ante los recientes anuncios del presidente Biden sobre la vacunación obligatoria contra el COVID-19, ¿cuál es su plan para cumplir con la norma aquí en el estado? Y si serán multados o castigados quienes no acaten la medida. Gracias.
Estamos orgullosos de que el 76% de los adultos de Colorado ya han recibido la vacuna. Estamos evaluando lo que significan las nuevas reglas federales para coloradenses, pero es importante ahora llamamos a la civilidad y el respeto para todos, a lo largo de este proceso. Nadie debe esperar para un anuncio del presidente o del gobierno para recibir la vacuna. Es una decisión importante para su salud y la salud de su familia recibirlo ahora mismo.
It's our understanding that any OSHA rule would not impact a government worker. So if I'm in a county or a city that does not have a mandate, that this federal rule would not apply to me because my city or county has their own mandate.
We want to know all these answers just like you. So we for instance, we don't know who it applies to in education. They mentioned Head Start. Does it apply to Title I, which are federally funded teachers in schools? We don't have the answers yet. So we have our own plan for our 31,000 state employees. Many local governments have implemented their own plan. We're not yet aware of how any new federal rules will impact the way that our state and local governments affect our workforce. Did you have a follow-up?
What will you be doing besides asking these questions to the president next week? What will we be doing with him?
Well, first of all, I mean, I think these are things that we expect to get. I mean, this is a very normal way of announcing things. They announced the 6 broad steps, what's happening. They even said in there's going to be rulemaking, there'll be the policies developed. That's actually good because it gives us a chance to provide input during this process, other states to provide input. I fully expect we'll get all these answers and highlight the unique needs of Colorado in that process. So we'll look forward to being in conversations with the federal government. This just happened yesterday. I haven't got them any feedback yet, but I'm sure our local governments and our state will, and our school districts will certainly provide feedback to implement this better and effectively and make it clear exactly who should do what. So we will be doing that in the coming days and weeks, and we're expecting the clarification. But this is a very normal way of doing things, Marshall. I mean, the announcement is made, and that starts the process of how they can receive input and actually do the fine print on how all these rules are implemented.
Polis, Sarah Flower with KSUT. As your team has talked about today, the alarming rate of hospitalizations across the state with fewer than 200 ICU beds available. In the past, you had said your gold star for implementing a mask mandate would be when hospitals are at capacity. Is this something that you and your team are thinking about in implementing a mask mandate anytime soon?
Well, thankfully, hospitals are not at capacity. While it should ring alarm bells that we have, I think, 197 ICU beds available. That is different from states that have 0 ICU beds available. We do have ICU beds available. We do have a higher vaccination rate than many of the states that are suffering from overwhelming of their hospitals. And finally, of course, we will continue to watch the data on a day-to-day basis. It looks like, hopefully, the rates have stabilized. There may or may not be a decrease. It's too early to say with regard to that. But certainly we'll continue to keep that North Star in mind. And while many of our hospital workers, our nurses, have just felt a huge brunt of the burden these last few months, even now, and it is particularly frustrating for many of them because this is all unnecessary because the people could be vaccinated and they're not. And so it's one thing to deal with and help treat people who have to be there and have a health crisis. It's another to treat people that don't need to be there and could live and thrive if only they got vaccinated.
Hello, this is Meg Wingeter from the Denver Post. This might be a question a little more for Dr. Herlihy.
I'm having a little trouble hearing you. Could you speak a little closer to the mic?
Okay.
Thank you.
Okay, this question might be more for Dr. Herlihy. Obviously, there's a difference in risk both to the individual and of spreading if you're vaccinated. But with the hospitals in kind of a fragile position, is there any value if you're a vaccinated, avoiding doing public indoor kinds of things or reinstating any more of the precautions people might have been taking in previous waves?
Sure, thank you for the question. So CDC has shared some data that has shown that while vaccine breakthrough cases are rare, when they do occur, that individuals who have previously been vaccinated get infected, they can go on to spread that infection to others. And that was really part of the reason for the recommendation from CDC for masking when disease rates are high universally, regardless of vaccination status. So I think that's something for individuals to consider. We know that vaccine breakthrough cases can happen, especially individuals who might be at higher risk of a severe disease outcome. So people with chronic medical conditions, older adults who might be more susceptible to being vaccine breakthrough cases, or parents who might have children at home that are unvaccinated. Those are all groups that might, especially be interested in wearing a mask in public, even if they have been vaccinated.
This is Erica Meltzer from Chalkbeat. With what we've seen and with school outbreaks doubling week over week and with the high rate of cases in children, do you still feel like this local control approach where school districts decide what's good enough, is that working? And if it wasn't working, I guess, is it working?
Yeah, I know that there are some states where their governors have tried to ban, mask use across all schools. I think many of those have been tossed out or tried kind of one-size-fits-all solutions. In our state, we want to empower and equip our superintendents, our county health, in consultation with county health, to really have the tools they need to retain in-person education in a way that works in each community. There are classes, and in some cases schools, that have to go to quarantine for a period of time to prevent further outbreaks. But by and large, kids are in classrooms this year across our state. They were last year too, especially in the second semester. And that is a very important piece of education. It's important from a social emotional perspective. It's important from an academic perspective. And it's important from a workforce perspective for parents. And so we plan on continuing to work to empower our superintendents to have the tools they need to provide safe in-class education, including the tool we've made available of universal testing for kids and staff.
Are you okay? So what I'm hearing is that there's no plan to have any new requirements for school districts. If they want
There
to
is
continue.
today. There's new guidance that went out from Dr. Herlihy and others worked on. How that is implemented is up to local districts, their county health departments. But we are providing some more tools. Two areas of focus of that new guidance. One is the beneficial impact of ventilation, particularly in fall. That can be as simple as open windows, which should be the case in classrooms that have windows, as well as HEPA filters. Also, the utilization of the increased testing to decrease the amount of people impacted by quarantines to ensure safe in-classroom construction can continue and building testing into that framework. And so right now I think we're at a couple dozen districts that have are participating in the state-supported, federally funded, state-funded program. We certainly encourage more school districts to participate in that program as well, and that can be an effective way to reduce the need for larger quarantines through the use of broad testing.
Governor, I know you're still waiting for guidance from the White House as far as the president's announcement about vaccination requirements versus testing requirements for larger employers. But I'm wondering if you foresee there's going to be any kind of issue for private companies when it comes to paying for these tests. In some cases, the tests are free. In some cases, they are not free. So do you foresee any kind of a difficulty there with that?
Yeah. So two things. I mean, the president's announcement is not too different than what we implemented a few weeks ago for our state workers' requirement, vaccine or testing. There is a very large number they threw out of tests that they have ordered. It seems beyond the number that would just be for the public sector or for the health need. So I am hopeful that out of that large number of tests that they've ordered, that will include availability for private employers who choose to implementing testing for employees to keep them safe.
Hi, Governor. John Daly, Colorado Public Radio. Thanks for taking our questions. On the school mask question, you talked about protecting hospitals and hospital capacity, that being your North Star, and also protecting the vulnerable, which would include the unvaccinated children, elderly, hospital workers. I wonder if you could just kind of tell us what you're thinking in terms of the mask mandate in schools. Wouldn't it make more sense to issue one now to prevent hospital capacity from being breached than later once if hospital capacity were to be breached?
Well, many schools, districts have implemented mask requirements. In fact, certainly the majority of students in our state are the substantial majority are wearing masks every day. There are, as I said, governors that have prohibited mask requirements in schools. Where we have come out is you absolutely can wear a mask, even if you live in a district that doesn't require it. It's a decision that is a good decision and that students should make, particularly if they're unvaccinated students. So by all means, those who want to wear masks should wear masks in school. We have not in any form taken the steps that some states have to prevent mask wearing requirements. Many districts have those, certainly the districts that serve a majority of Colorado students. There are only, as we indicated, 17 pediatric hospitalizations at this point. We do look at pediatric hospital beds separately from adult hospital beds because they are different with different capacity restrictions. We are currently not in jeopardy of exceeding our pediatric or our adult capacity for hospital beds in Colorado, but we continue to track that data regularly. Well, first, our state patrol has core values of honor and duty and respect, and they hold those values very high. We all understand that there is a need for trust and confidence in law enforcement. Mr. Hempel has dedicated his life to public service, protecting Coloradans, protecting our state capital. And I don't have any further comment I can make on an ongoing investigation.
Governor, one final question on the, I know your priority is the unvaccinated,
Yeah.
but any chance there will be, or have you discussed a booster mandate for state employees, and have you yourself received the booster?
I haven't, but I plan to. I encourage, really at this point, I encourage people in their 70s and 80s to get the booster, as long as it's about 6 months after, 5 or 6 months after the last. The data is really strong on the booster. It looks terrific. Stronger immune response. One study, 97% protection, up from 85. Even more important for recipients of the Pfizer vaccine. We're expecting that will be broadly available September 20th on the Pfizer vaccine, maybe a week or two later on Moderna, but it is available now, again, especially for people in their 70s and 80s who, in general, have weaker immune systems with regard to COVID-19 in particular, but also other infections. So I think that's a smart move for people to do. I will get it at the appropriate time. And I particularly encourage people in their 70s and 80s and those who are immunocompromised who were vaccinated 5 or 6 months ago or longer to go ahead and get that booster, especially with a high level of community prevalence that the virus has in our state and across the country. Thank you.